Joining me now, Rich McCormick, Republican from the state of Georgia. I should also mention a physician. Doctor, Congressman, thanks for being with us tonight here on the Hill. I want your perspective here. Obviously, you're a Republican who supports the president. You're also a doctor. I just showed that chart, right? They went up under Bush. They went up under Obama. They went up under Trump. They went up under Biden, and they're still going up again under Trump. So let's set that aside. $5.3 trillion in health care costs this country spends. The president put out his plan today, and it calls for a host of things, Congressman, including lowering prescription drug prices, allowing Americans to buy their own insurance, requiring providers to post their pricing, and then the whole most favored nations clause. Do you understand what the president is trying to do here with his health care plan?
I do, and this has been a frustration for all doctors and hospitals and insurance companies. It's a moving target, and what happened during the George W. Bush era is we expanded Medicare dramatically, Part D, and that's what created that initial thing. The more the federal government gets in, the more expensive it gets, of course, because it's coming out of the federal budget. But realize that right now it's the largest expense for all Americans. It is a $5 trillion budget that we spend on that per year. Now, half of that comes from the American government, and half comes from your out-of-pocket expenses. But the average family spends more on healthcare than anything else they'll spend money on. That's just where we're at right now. It's far too expensive. It doesn't compare to any other nation around the world. So one of the things we did was say, okay, why don't we have the same drug prices as other countries for the same exact drug products? It doesn't make sense.
And President Trump wants Congress to codify that.
Correct.
Right. I'm looking, though, Congressman, at this. President's been president for 5 years, 4 in the first term, 1 now. He's been on the national stage politically for a decade. And the White House put out today basically a one-sheeter. How's that possible a decade in for this president?
Because of all the thick pages haven't done us very well. I mean, if you think about the Affordable Care Act, what was it, 3,000 pages? How did that do for us? Sometimes keeping it more simple is actually better. It's easier to pass, first of all. It's easier to understand, and you actually get to read it. Remember when the Affordable Care Act was passed, not one congressman, not one senator, and certainly not the president or his staff read that thing. Everybody voted on it assuming it was good. And look at what it's led to. Your premiums, you probably have at least 90% higher premiums. Your copay has gone up. Your deductible has gone up. The insurance companies are making 230% more in net profits since the Affordable Care Act. Doctors make less by 30%. Hospitals struggling and closing all around America. This is a failed system we're in right now, and we're paying a premium for
what about keeping
that nobody else around the world pays for.
Yeah, what about keeping Obamacare, though, Congressman? Because the president talked today about cost-sharing reduction for health care plans. That's a staple of Obamacare. So it seems like some of that is going to stay. Does that mean this idea of repealing Obamacare is dead?
It's pretty much dead because we need 60 votes, so it's not going to happen. So the reality is we need to tweak it. We need to create a competitive market where you have something to compete with the Affordable Care Act, which is far from affordable. If you have a free market solution where you say you have to have transparent pricing, we have to know what you're offering, and we're going to give you the money so you can choose between these programs, it's going to force the price point down. I'll give you a perfect example. The one thing that's not covered by insurance that everybody kind of goes to is LASIK eye surgery. It costs about the same as it did 40 years ago because it's an out-of-pocket expense and because it was competitive in nature and because people had to price it right. When insurance gets involved, when government gets involved, the price point always goes up. Look what they've done to education and energy and everything else that the government gets involved with. It always becomes more expensive.
The cost of health care since 2000, inflation up 87%. Again, that's over 25 years, right?
Exactly.
Healthcare up 312%. So basically running somewhere around 3.5 times more than that. Congressman McCormick, Dr. McCormick, with us tonight here on the Hill. We'll catch you again soon.
Always a pleasure.
All right.